I'm Karen Ciano, the president of St. Paul Sunrise Rotary. Welcome to the 16th annual Sunrise Community Forum. Since 2006, St. Paul Sunrise Rotary has partnered with other Rotary clubs to convene a community forum addressing an important issue through the lens of Rotary's four-way test. Rotary is an international service organization dedicated to creating and preserving positive peace in the world. One way we do that is by focusing on ethical decision-making. And to do that, we focus on the four-way test. We repeat the four-way test whenever we meet and consider it whenever we make decisions. For every choice we ask ourselves, and please feel free to say it along with me. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? And fourth, will it be beneficial to all concerned? Making decisions with the four-way test in mind helps shape the direction of change toward positive peace. This year, our community forum focuses on what safe and just communities in Minnesota could look like and how to become allies with the people and groups who are working toward truthful, fair, and beneficial change. So, welcome to our forum, everyone in this room, everyone on the Zoom. I am delighted to welcome Rotarians, including leadership from many clubs and several districts. Thank you for devoting your time and for bringing your voices and perspectives to this conversation. I hope you will be able to bring back what you learned to enrich your club's discussion. On behalf of St. Paul Sunrise Rotary and the Forum Planning Team, I would like to express my appreciation and gratitude to Minneapolis City of Lakes Rotary for hosting this event, the Women's Club of Minneapolis for their outstanding hospitality for our in-person guests, our amazing technical team for their support for our virtual guests, our co-sponsor clubs, Minneapolis City of Lakes Rotary and the Rotary Club of Roseville, and the League of Women Voters Minneapolis for sharing their findings on reimagining public safety, as well as lending us panel moderator Jane Lansing and graciously agreeing to help us with follow-up discussion. And I would particularly like to thank our panelists for the time they have spent preparing for this morning and for what I expect will be a very lively and meaningful discussion today. With that, I will turn it over to Ellen Lepker, head of our forum planning team, to speak briefly about what comes next.
Thank you, Karen. That was lovely and so exciting to see. I don't quite know how to behave when I'm in public anymore, but I thank you for your bravery coming out and being with us. As we thought about what critical issue are we going to address, the rising level of violence and need for safety just went right up to the top of our list. And I am so excited to introduce our panel today. They bring experience and knowledge to help us identify what is it that is happening, what's been the history of violence in our community and in our country overall. What is it who is working on this, on trying to find solutions? How can we as community members jump in and work with those that are seeking solutions to find answers? Rondo Arradondo recently retired as the Minneapolis police chief. You have dedicated your career, your entire career, to being a peace officer, and rose to the level of the chief of police. You have earned the highest respect for your ethical and community-oriented approach. You're close to Indigenous communities and communities of color. You know our city and its needs. I was deeply moved, as I mentioned to you earlier, this morning, knowing you grew up in the just a block or two away from the site where George Floyd was murdered by one of your own policemen. You showed up. I saw you on television and I was moved to tears how you showed up and you grieved with the community that was your community and shared your sadness and for the tragedy. I have also appreciated your kindness and your caring to show up here today to share your perspective and experience and tell us what do we need to learn today so that we can take steps to make this a safe and just community. And Sue Abder-Holden, Executive Director of the NAMI Minnesota National Alliance on Mental Illness. We are so fortunate to have your leadership and wisdom, seemingly tireless advocacy for legislation to build the mental health system, create a statewide mobile mental health crisis system, promote criminal justice, diversion programs, and ensure that peace officers are receiving quality training on mental illness and de-escalation. Sue, please share with us what you see that we need to know. What steps can we take together from your perspective to create and support a safe and just community for all? And Jane Lansing, current chair of the League of Women Voters, Minneapolis. We are indebted to the League's sharing Jane with us today because she has, and the team that created this study, did this study over many months, have made sense out of this complex issue. And Jane, you come as a 35-year resident of Minneapolis. You're a retired executive with a long career in technology and global business. And you also serve on the Dean's Advisory Board for the U of M College of Science and Technology. We are so grateful to hear from you today, what you have learned. Thank you very much, Jane, also for serving as our moderator today. And I'll turn it over to you. Thank you very much.
Thanks to Ellen, thanks to the Rotary for sponsoring this really important conversation, all of you guys for showing up. I think the first step in creating a just and safe community together is really understanding this really complex issue. So the way this is going to work this morning is we're going to go through, each of us is going to go through about a 15-minute kind of a summary of what we bring to this conversation. And then we're going to open it up for questions. And the questions are going to come both from Zoom and from you in the audience. And you all have an index card on your chair. There's a pen to be shared amongst your aisles. So during the contextual information at the beginning, please write down your questions, write them as legibly as possible, like you're typing into Zoom. And then we'll have people gathering those questions, and then I will be feeding them to our expert panelist. So I am going to start by just providing a summary of the study that the League's Reimagining Public Safety Committee did. Just as a brief overview, the League is a 100-year-old nonpartisan organization. Nonpartisan means that we don't endorse candidates, but we do support positions, but only after rigorous study. And so after the murder of George Floyd, the League convened a committee to study this issue, really anticipating that there were going to be ballot issues and how could we help our voters understand what was becoming a really polemic and inflammatory issue in the press and in the public. And we said, how can we best help the voters understand this? And so we undertook a 9-month study. There were a dozen people on our committee. And we determined that the best way that we could help our voters, not being experts ourselves, but there was a tremendous amount of material out there by experts locally and around the world and around the country rather. And how could we take all of that information and summarize it and publish it and educate our voters so they could make sense of it in a simple and easy way. And so that was the process that we went through. So what I'm going to do is I'm going to give you a Cliff's Notes version of that study. And then you can refer to the website for more information. So first of all, did we have a problem? And what we learned by looking at the research is that there is a long history of concerns and problems of police misconduct against minorities, people of color, in Minneapolis and across the country, really, looking at all the research. These are just some of the research papers that we looked at. The ACLU did a really excellent data-driven study in 2015, looked at the disparity between how people of color and whites in higher socioeconomic neighborhoods were treated. It's really marked differences. The MPD 150 documented 150 years of police misconduct against minorities. And they used the process of interviewing hundreds of people, not only victims, but also people that work in the public sector assisting those victims. The state of Minnesota did a report of police violence. So this was convened by Ellison and Harrington. And it was really a working group about police involved in deadly force. It was published in February of 2020. And then the University of Minnesota Center for Urban and Regional Affairs from 2017 to 2019 did a study looking at North Minneapolis. And all of these were before George Floyd was killed. And so I want to mention, obviously there was the state of Minnesota released their Department of Human Rights released a report yesterday, which is big news nationally, but it is really consistent with everything that we found in our study. So if you've been involved in looking at this, it was not really new news. They did dig into some new aspects of it, but so I guess the first thing I want to say is there is a problem, not just in Minneapolis, but across the country in police departments, because there is a long history of misconduct and excessive violence against minorities and people of color. The second thing that I want to point out is that the research shows that the police are not really trained or prepared to deal with the myriad of problems that confront them. This bar graph comes from a study of police calls that Minneapolis just commissioned earlier this year, looking at all the call outs. And it's a bar chart shows the types of calls to police that they respond to by frequency. And you can't read all of them across the bottom, but if you looked at them, you might say, well, where is shots fired or assault or murder or rape? Now they're there, but they're way off the chart. Because if you think about it, Minneapolis gets over 1,000 911 calls a day. And if it's a fire or a medical emergency, you know immediately which expert to respond to. Everything else goes to the police. And so you end up with things like traffic enforcement, suspicious person, welfare checks, domestics. And if you look at the training that the police get, in general, that pie chart up there, all the blue is looking at law enforcement, the policies and procedures, use of force. Only, 10-15% is dealing with things like medical, social, de-escalation, those types of things. So there's a mismatch between the training and all the things that the police are called on to deal with. I will also say the need for relying on all of those use of force things is also important when you consider that the number of weapons on the street is increasing. So that becomes a really, the issue is really complicated, to say the least. Let's say the third thing that we really dug into, and this was particularly important in Minneapolis, because as we were looking at this, it was, let's look at the police department. There's a problem with police. But as we started peeling back the onion, the public safety landscape is really complex. We see the police as the front line, but there's a lot of other aspects to the police. At the federal level, there's the concept of qualified immunity, which is designed to protect public employees for their actions on the job. And on the surface, it seems like a great idea. But critics argue that it's been unreasonably applied in the case of police officers, where over half of the officers have been who've been accused of violating people's rights, typically for the use of excessive violence, excessive force. They've been granted immunity. And then just kind of marching through this real quickly here. If we look at the state, there's the legislation, the Department of Human Rights, who just generated that report that was in the news. The Post Board is the Peace Officer Standards and Training, who defines training standards and licensed police officers. We look at the county, a lot of the social services money in the state flows through the county, and I'm sure that Sue's going to speak to that and the important role the county plays here. Within the city, in addition to all the city officials and city government, you've got 911, the Office of Violence Prevention, and I'm going to address that in a little bit. We also have in addition to the police, there's the Police Federation and the police contract itself. And all those things go together and they sit on the background landscape of the community. So we are a part of this also. So in a couple of different ways. First of all, we call on the police. And I always think of that case in Aurora, Colorado, where a citizen in the community called the police because there was a sketchy character on the street. This was Elijah McLean, I believe his name was. It was a guy in a hoodie walking home, calls the police. He ended up dying at the hands of the police. But it started by the community calling for the police because of his character, one of those calls. The other way the community is involved is that we elect all those officials. And so as we want policies to change, we need to become involved, which is why I presume you're all here. And elect officials and make sure that we are lobbying for policies that give us the public safety that we want and need and deserve. So just to summarize, from the problem perspective, what we've talked about is that there's a history of violence and discriminatory practices. We're calling on the police for more than they're trained to deal with, and we need to look well beyond the MPD and police departments to truly understand the public safety landscape. So how to address? There's broad agreement that the public health to approach to public safety is the way to proceed. And cities all around the country are moving in this direction. You see quotes from Jacob Fry and Yes for Minneapolis, who are on opposite sides of the ballot initiative in Minneapolis, who are both saying fundamentally the same thing, is we need to be able to respond to police calls with a variety of resources. The CNA report was that recent report that looked at police callouts, saying even the police agreed that it would help diverting calls to experts that have more expertise in some of these things would ameliorate burnout and morale issues. So Minneapolis is evaluating a diversified response. So this was that report that the city commissioned. And what it did is it looked at all those call outs, and then it started to look at what calls needed to be responded to from the police by statute. And that's the blue. So we absolutely, by statute, need the police to respond to certain calls. But some of those calls, the ones in red, could be responded to by behavioral health professionals. And some of them, and so the behavioral health ones are things like, welfare checks, some of the domestic violence types things. And then others could be responded to by reporting and maybe some civilian or specialty reporting individuals. And you notice that the red and the green lines that could be responded to by people other than sworn officers actually take more time. So I will also say that violence prevention is a key leg of the stool. Tony Boza, a pretty infamous chief of police in Minneapolis years ago, once said, once the crime is committed, the criminal has already been formed. By the time the police are called, the crime is committed, the criminal has already been formed. And violence prevention is there to actually stop the crime from being committed in the first place by intervening and stopping the criminal from being formed. And so violence prevention departments, they work with youth, neighborhood, peer programs in the community to really prevent the violence before it happens, intervene, and then heal after it happens, and healing victims, healing the perpetrators, so that, you know, one mistake, by a youth doesn't ruin their whole life. But going back to the first statement that I made, that we do have a problem with police misconduct and excessive violence, police reform is needed from multiple directions. So first of all, from a behavioral perspective, some of the rules need to be changed around chokeholds and just the way police handle things. And as we go through things, eliminating minor traffic stops, prohibiting officers from reviewing and disabling body cameras. But critics will say that you cannot rule change your way out of a culture problem. And changes to the culture are really critical in addressing this issue. Things like recruitment focus to attract people, attract more women, attract people of color, attract people with social services background, recruiting for character, and banning warrior style training, active bystander training, and fundamentally changing the training that the police officers get. These are just examples, but I think it's important to note that we have a 150-year-old problem, and it's going to take time to address, and we need the involvement from people in the community. So for that reason, this is a really important forum, and we're really grateful for everyone to be here. So this was just, as I said, a cliff notes of the League's Reimagining Public Safety Study. There's a complete website out there with little articles on dozens and dozens of articles on all aspects of public safety. And I encourage you guys to take a look at it. And so with that, I'm going to turn the session over to our expert panelists to look at this issue from their perspective. So, Rondo?
Thank you very much, Jane, for summarizing that report. Thank you all for being here this morning. This is truly my first public appearance since I officially retired, so I'm happy that the Rotarians and the League and the Minneapolis Club, Women's Club have invited me here. So thank you all. You've been just so gracious for me. So, I will keep my remarks short, but what I'll start by saying, you know, a good friend of mine who's here in the audience today, Tim Kingsley. Tim, you back there? Okay. So I'm reminded that the first recorded murder that many would say was Cain and Abel, and what occurred. So this condition of the heart of individuals harming one another has been with us for a long time. And over the course of time, societies have decided to entrust men and women through a very important social contract. And I'll get back to that in a minute, but a very important social contract to be guardians over their communities. And that is so incredibly important when you think about knowing that we are all imperfect human beings, but we are entrusting others who are imperfect to have our best interests, our goodwill at heart. And I'm reminded of the 4 steps that you started out with this morning. But in that, we've created what today is the American policing system. And I'll be the first to tell you, it is not a perfect system. Our democracy is not a perfect system. Our society is not a perfect system, but we have to constantly continue to evolve, continue to make sure that we are leaning in. And by the way, and when I was in my previous role as chief, you are all my boss. And everyone that wears that uniform, you are their boss. So it's incredibly important that we try to continue to evolve to get it right, because it matters. Back in the late 1800s here in the state of Minnesota, when police departments were first formed, we were actually the first paid social workers with enforcement authority. We were, of course, directed to deal with social order or social disorder, but along with that came all of these other things that our communities experience. People who are experiencing homelessness, addiction. Sue will talk certainly about the components of mental health in our communities, but that was also another part. But unfortunately, what did not occur is our communities and our society started to evolve at a rapid pace. Our police departments were not equipped and trained to deal with that fast, ever-changing societal needs. And so oftentimes, and I know that we have some distinguished elected officials here and they will attest to it, oftentimes police departments were the catch-all to try to address all of those things with limited tools, limited resources. We could talk about legislative laws and certainly city ordinances. But what happened as a result of that is that, and Jane just talked about the one slide, we were the call. We were the individuals that at 3 a.m, whether it was a barking dog or whether it was your neighbors arguing about something, we were the ones to be called to respond to that. And so over time, the most important speed at which police departments operate is the speed of trust. So we can change all the policies, all the legislative laws, all the city council ordinances, but the most important speed that we operate is at the speed of trust. If those that we are entrusted to serve do not trust us, none of those things on paper matter. And when it comes to the use of force, for example, of all the calls, Jane mentioned that there are about 1,000 911 calls placed in the city of Minneapolis every day. I will attest to the fact that out of all those calls, the most singular call that we will be judged forever on is that use of force, and particularly if it's deadly use of force. We are a profession that we are not judged like many professions on the body of our work, but by that singular incident. And so we have to try to get it right each and every day. And that's critically important, as I mentioned, that trust that we have with everyone. But as we continue to evolve and lean in, and I'm a firm believer that the world is run by those who show up, so I'm happy to see all of you here today, and I encourage all of our communities. Anytime that when I was chief, I'd go out and speak to our communities, show up. City council meetings, school board meetings, park board meetings, show up, because that is where these rules, these guidelines, these laws are all shaped. As we have continued to evolve, we also are dealing with issues that, they say that politics are local, so is crime. And our communities are not monolithic. And so in terms of our services, they have to be catered and shaped and molded, particularly based on that community need. So there is not a one size that fits all when it comes to public safety. We, over the last 40 years of policing, particularly the last 30 years, we started to really address and try to deal with this issue of what we call trauma or mental health. There's been studies, particularly after the Vietnam War, that looked at soldiers returning back and PTSD and the impacts that that had on it. But we really, in terms of our own policing profession, we really didn't start looking at trauma and crisis until the last 30, 25 years or so. And some of you may remember the crisis intervention training that many departments started to utilize about 20, 25 years ago that equipped the Minneapolis Police Department with training in the first ever use of tasers. But we still have a lot of work to do on that. I mention that because while they were looking at soldiers who were in battle and the PTSD that they experienced, we were not realizing that, and the research shows that individuals who are exposed daily to trauma, it impacts them greatly. And so when you have our officers out there who are seeing horrific scenes and going to calls that many of us would not even want to imagine, that does have an impact on them. We have lost more officers to suicide in the past couple of years than in the line of duty deaths. I mean, just think about that for a moment. So we have to do better, because if our officers who are there to serve you are not well, and they're responding to community that may not be well, that's a perfect recipe for bad things to happen. So being able to eliminate the stigma of trauma with the folks that wear this uniform, we call those invisible injuries that impact us. We have to do better at that. And I appreciate the fact that we are doing more about that. We're speaking about it. We're trying to eliminate the stigma. We're providing more resources for health and wellness. We're talking about things such as sleep deprivation, which is a horrible thing for individuals. We need to talk more about that. Nutrition, all of these things. Our officers have the same issues that many of our society have. You know, they're dealing with maybe aging parents, divorce, children who are terminally ill, those types of things. And so we have to make sure that we've got the resources for them. Now, while we certainly want to make sure that our officers have the assistance that they need, but there are many in our community that don't have the luxury of picking up the phone and calling EAP when they need help. And so we have to do a far better job of that. I'm happy that we've worked on some collaboration in terms of involving officers who have training with mental health education to work with professionally trained mental health social workers and providers. But there's much more that we need to be done with that. We're doing more things in terms of, even as if we have to make an arrest with someone, our jails are doing a better job of doing screenings and intakes of those individuals to make sure that they have the necessary resources that they need. But all of this, again, is working under the premise that our societies are dealing with so much. So we have to continue to learn. We have to continue to be in those spaces. And what do some of those things look like? I'll give you a couple of examples. A group of individuals in our society, and certainly here in Minneapolis, that have felt invisible for a long time are young people. And it's important for us to understand that so much of what we do and so much of the burdens that are placed on our society directly impact our young people. We have young people that right now are riding the light rails and buses because that's their only safe place for shelter. Many are struggling with addiction. I believe there was a report recently that talked about the high rate of suicide from this pandemic of teenagers. There's so much that is impacting our young people, but it's important not just for them to be at the table, but we really have to lean on them to help guide those discussions and solutions in terms of what works best for them and how we can move forward. I'll tell you, just share another example of I call it the power of a story. Several years ago, I happened to be a part of the city of Minneapolis's transgender, gender nonconforming committee. I happened to be at one of these summits, and a African-American trans woman approached me during the intermission. And I was not wearing what I'm wearing today. I was wearing that polyester, unfashionable uniform. And so there was a little bit of apprehension about coming up to me that I could sense. But the individual looked at me, and after exchanging names and how are things going, she was courageous enough to say, "Rondo, when do you go grocery shopping?" Is my response. Interesting question. And when I knew that she was serious, I said, usually on the weekends, probably 2 or 3 in the afternoon. And she said, "Interesting." She says, "I used to go grocery shopping, Rondo, on the afternoons at Saturday at 3 in the afternoon. But," she said, "when I started going grocery shopping the same time you did, I got looks from people." And I remember one time, Rhonda, when I was going grocery shopping at 3 in the afternoon, I was waiting for my bus, and a squad car slowly circled around and looked at me and stared at me and did it again, thinking that I was a prostitute. Or there was also, she said, I happen to also have some obnoxious college athletes calling me names. And I had a parent shield their child's eyes from me. And so she says, I don't go at that time. Now I go at 2 in the morning to avoid that. And she says, one of the other things, Rondo, that I experienced from a police officer was when they stopped me and asked me for my ID. And even though the state ID had my name on there, but I told them specifically, please refer to me as, and she mentioned her name. They didn't. And she mentioned how that made her feel. I say that because it was through that power of that story, that conversation, she was able to help me meet with some other folks in our trans community. And we adopted the first ever MPD guiding principles in terms of our engagement interacting with trans. And so, but we have to remember, we have to meet our community where they're at. And so we will continue, I believe that we will continue to do that. We will have to continue to evolve. We will also have to continue to hold ourselves accountable. But we are all in this. Jane mentioned something that is very true. Public safety and what that means to everyone can be very different. It's very complex. One of the things that I did not have the opportunity to do since my retirement, but had I still been your chief, the next budget presentation you would have seen me present to our city council, I would have actually had CEOs from Alina, Children's Hospital, and Abbott. The reason why I say that is because historically and traditionally, when I've given my budget, there are some who think that this is just Rondo's budget of goodies. And it's not. One of the best pieces of advice I got from a CEO at one of our local anchor hospitals is, Rondo, if you really want to see a snapshot of our city on any given day, come sit in our emergency lobby room. Truly powerful. And I did. And I did. Our hospital emergency rooms and lobbies, they see everyone, regardless of your age, if you're Muslim, Jewish, Christian, straight, trans, they see everyone. And they have that principle that I've certainly believe is so important for police agencies to instill, is that first, do no harm. And so I am also a hopeful optimist, as layered and as complex as public safety is. I believe that with goodwill and good intentioned people, we can get there. It doesn't mean that we're always going to agree. Doesn't mean that. But I believe that if we show through our collective humanity, we can get there. We can do better. And today does not have to be the tomorrow for our children. And so I will leave you with that. Thank you so very much.
I'll turn it over to Sue, but I just want to remind everybody on Zoom and in the room to fill out your index cards, because when Sue's done, we're going to go into the Q&A. So be writing down your questions neatly. So Sue, I'll turn it over to you.
Thank you. And thanks again for inviting me this morning. So I think we have to think about, like, a safe community for who, right? A just community for who? Is it safe for people with mental illnesses to live in our community without the supports and treatment that they need? They become much more vulnerable, right? And much more the victim than a perpetrator. Is it just for people with mental illnesses to end up in the criminal justice system due to the lack of access to treatment? And while the word violence is in the description this morning, I want to be sure that people don't link the word violence with people with mental illnesses, because we know that that's just not true. And even though we have a high number of people who end up in the criminal justice system who have a mental illness, it is largely for nonviolent crimes. I think we have to think about, is it really, is our community truly safe when people with mental illnesses who can't access the mental health treatment or substance use disorder treatment they need, when they can't afford the housing because they're living on Social Security, supplemental security income, when they become further isolated from family and friends due to our archaic HIPAA and data privacy laws? Is that really just for them? And is it a just community when private insurance won't pay for the mental health treatment that people need, when they have such narrow networks that people have to wait months, 3 to 6 months, to see sometimes a therapist or certainly a psychiatrist? And then it doesn't actually cover the array of treatment and supports that people need in order to be well in the community. is it just that Medicaid actually discriminates against payment for mental illnesses? It does not cover any type of facility that has more than 16 beds where over half of the people are being treated for a mental illness or substance use disorder treatment. Medicare also discriminates. It doesn't pay for every type of mental health professional, particularly licensed professional clinical counselors and marriage family therapists. Those two types of mental health professionals largely serve communities of color in rural Minnesota. Medicare doesn't pay. Medicare has a lifetime limit on the number of inpatient psychiatric hospital bed days. Doesn't do that for any other healthcare condition, but does it for mental health. When we kind of go back to look at why people with mental illness end up in our criminal justice system, it really is looking at the failure to meet their mental health needs. While we can think about it as the way that we treat people with serious mental illnesses is we wait till we hit stage 4. So, we don't do that for other healthcare conditions, right? But you have a diagnosis of schizophrenia, you aren't going to get intensive care right away. Our system says we're going to wait until you have a serious and persistent mental illness. So we're going to wait until you've been committed or hospitalized a number of times. Then maybe we'll provide intensive treatment. We don't do that for any other healthcare condition. And then we wonder why people with schizophrenia and bipolar disorder in particular end up in our criminal justice system. And that just isn't right. A lot of people come up to me and say, our mental health system is broken. And I just want to say that isn't true. If you look at the history, what you see is that it was never built. Medicaid doesn't pay for everything. Medicare doesn't pay for everything. Private insurance doesn't pay for everything. And so what we ended up doing was relying on grants. And we couldn't fund cancer treatment with grants. We couldn't fund heart disease with grants, right? And so we couldn't build a system if you didn't actually have money. And that's been really the huge barrier. We have had so many reports, even before I was born, that if we just implemented them today, they would work. President Eisenhower had the biggest report. And when you go through it, what he said is every community hospital should have a psychiatric unit so that people could be cared for close to home. We need to make sure that we have mental health professionals in our schools to help children. We need to have a crisis system. We need to have residential treatment. And that was President Eisenhower. How many more reports and studies do we need before we figure out what to do and before we have the will and determination to do that? The other thing we have to think about is when people are actually struggling with their mental health, what do they and their families do? Sometimes people have insight, and so they're able to reach out and try to get access to treatment right away, which again could take some time. But if someone doesn't, and the families can't convince them to go for treatment voluntarily, we end up, frankly, in kind of a spiral downward. So people are having delusional thoughts or hallucinations, or perhaps they're manic or they're, feeling suicidal. And again, their loved one won't go for treatment voluntarily. The only thing they can do is wait until someone becomes a danger to themselves or others. And once they hit that point, we can call the police, who will have to transport them involuntarily to an emergency room. And so when you want to talk about why are police involved in our mental health system, that is why. And unfortunately, what's happened lately, and I know, Rhonda, this is an issue, is because of the change in use of force laws, we actually had police departments say that they would not intervene if someone was just suicidal and there was no one else in the house. They would not enter. And of course, for us, that was not we of course strongly disagreed with that because we have a chance to save a life. And as far as we're concerned, police officers are first responders. But it is really hard when we wait until that point, and there's nothing else we can do. And what we also see is that if officers are not well trained and they come into a situation where someone, is in a true mental health crisis, that if they don't use the training they did receive, we see it blow up. And maybe the person actually accidentally hits the police officer and now they've committed a crime and now they're going to go to jail instead of to the emergency room. The thing that we've seen over and over again in talking with sheriffs in particular is, they say we have all these people with mental illnesses in our jail. And I have to ask them, who brought them there? I mean, truly, who brought them there? It was the police. And police had a choice to bring someone to the emergency room or bring someone to the jail. And they have a lot of discretion in terms of what they decide to do often in these situations. And so we can't just blame the mental health system. We also have to look at the police and say, could you have done something different? Could we have provided a different option? Now, I want to say that we have taken some good steps to try to address this issue. One of them is actually early intervention. So we actually have a model program in our country, in our state, in terms of the country, of providing mental health professionals in the schools. They are not employees of the school. The grants actually go to mental health providers who co-locate. And so they can bill insurance, so it's a more sustainable model, but we're really trying to intervene early to help kids in particular get back on track. We also have what's called the first psychotic episode programs. And so this is wanting to make sure that as soon as a young person is experiencing psychosis, that they get hooked up with intensive treatment, not maybe a pill, but intensive treatment. The average wait time is about 74 weeks between someone experiencing psychosis and actually getting treatment. That is way too long. And so these programs actually really wrap around these young people, providing not only medication, but therapy and support with other students, other young people, and helping those young people get back to school or work, which is really important, providing that family education. And the outcomes are terrific. Now, we need at least 8 of those programs in Minnesota, and we have 4. If we knew of a cure, right, an easy cure for something like cancer, our state would be all over it. It would be covered under Medicaid, right? Everyone would be providing grants for it. And that we know that for one of the most disabling conditions in the world, we have a pretty good solution and we don't fully fund it, in my mind, is horrible. We also have, looking at this session anyway, also funding an emerging mood disorder for young people with bipolar disorder or serious depression. Same concept, right? And then we would study it. In our state, which you wouldn't know from reading the paper, every single county has a mobile mental health crisis team. Every single one. Unfortunately, of course, they're not funded like we fund any other first responders, and so they can't respond immediately. And if you look at, for example, northwestern Minnesota, it's quite a few miles in between any of the calls that they're going to make. But they are very effective in coming in, evaluating someone, providing stabilization services, assessing to whether or not they would need hospital level of care, and it really is very effective. One of the things that we know, though, is that there's over 44 numbers for all those crisis teams. No one knows them. Any event I go to where there's mental health professionals, I ask them, how many in the room can tell me your local mental health crisis number? And hardly anyone raises their hands except for the people who works for the mobile crisis team. And so, we tried to get one number. We tried to do Star Crisis, which didn't work for all plans. But then last year they passed Travis's Law, which requires 911 to send out a mobile crisis team where it's appropriate. So we have no wrong door for someone. Now, this is just starting to go into play. Actually, St. Paul's been doing it for a couple of years, and it does work really well. And you have trained 911 operators knowing who to send out. And again, when you call 911, a number that everybody knows, right, you want to send out the appropriate person. Fire department if it's a fire, police if someone's robbing your house, right? EMTs if you're having a heart attack, and then sending out the mobile mental health crisis teams. The other thing I want to say is we have focused on police training, really looking at now we're going to look at, so what's the quality of the training they're getting? Who's doing it? Can we evaluate the results in that community? A lot of people are embedding mental health professionals in 911 and with police. I will say we need to be careful that we don't create such a muddy system that nobody knows who's doing what. One of the things that other states have done is created for lack of a better word, central receiving centers where police can drop people off, where they can be assessed, and then they leave within 23 hours. The problem is that then the way into the mental health system is through the police, which is not what we want to do. And it's not anything that anyone knows, right? And we don't have a problem with people being assessed in emergency rooms. It's an appropriate place. The problem is they have nowhere to go. So the place that they need to go doesn't exist. And so we don't want to create these separate things. We want to keep it within our healthcare system because our head is connected to the rest of our body. We do have psychiatric ERs, which are great so that, that you're not in a noisy place and it's staffed with mental health practitioners and professionals. We have crisis homes in Minnesota. So if someone doesn't need that high level of care in a hospital, they can go to a crisis home and those work really well. And of course, we have a lot of community services as well. I do want to say that, a couple of things that we are worried about, again, is the confusion between the crisis teams and now these things that cities are doing by themselves, because we're not sure how they're all going to come together, and our workforce shortages, which right now is immense. And so even if people wanted to expand their services, it's going to be hard to find someone. There are some additional solutions I want to quickly mention. One is 2 years ago, as part of a change to the commitment law, we created what we called voluntary engagement. So if a family member was worried about someone before they were a danger to themselves or others, they could actually call the county and they could send someone out, and it's not a one and done. So if they came out the first day and the person said, no, I don't want services, they can come back the next day and the day after that and the day after that for 90 days. They can provide support to the family. They can try to engage with the individual, create that relationship, and voluntarily get them into treatment before they're a danger to themselves or others. Unfortunately, we couldn't mandate it for counties. And right now, there is not one county in the state of Minnesota that is doing it as we imagined in the law. And so when we talk about how can we get there earlier, that is the way we can get there earlier. Lastly, I want to say hospital beds, we need them, but we need them within regular hospitals because our head is connected to the rest of our body. We need to treat the whole person. As I was talking to Eric this morning, there's this report out there that says that Minnesota has the lowest number of hospital beds per capita. Please delete that report from anything you ever read because they only measured state hospital beds. They don't measure all of the community hospital beds that we have in Minnesota. So it's not true. And the report says Mississippi's #1. So you got to know something's wrong with the report. In terms of what you can do, we need more people to actually be pushing for more funding for our mental health system. And so don't wait till, a situation involves you personally. Please reach out. And the other thing is, in order to develop community services, we need them in the community. And so NIMBY, not in my backyard, is huge. And every time we try to have a new, crisis home or residential facility, children's day treatment, right? The neighbors come out and say, no, we don't want those people in our neighborhood. But those people are already your neighbors. And so what we want to do is to make sure that people have access to the care that they need and the quality that they need. And one last thing is a huge issue that we've been working on for 3 years is competency restoration. So what happens is someone who has a misdemeanor and is not competent to stand trial, those charges are dismissed and they go back into the community without being connected to anyone. We had a huge stakeholder group. We've come to an agreement. The cost will be under 15 million to really create a system so we have forensic navigators who are actually connected to that person, help them get housing, help them get health insurance, help them get connected to services so that they don't have the revolving door of the jail anymore or the emergency room. And we can really bring them dignity, frankly, to their lives and create a more just community. So thank you for inviting me this morning.
Thank you guys very much. We have a lot of questions, so this is going to be, some of them are more legible than others. I'll get to the most legible ones first. I guess this one goes to Rondo. In Minnesota, do we have world-class educational institution for educating police officers? And what do you think we need, or how should the education for police officers be changed?
Yeah, that's a really good question. So just a little history, most states up until 1970 did not require licensing for their peace officers. Minnesota, California, there's a few other states that were really the first. So we have really, in terms of the educational requirement, which by the way, in Minnesota requires at least a 2-year law enforcement degree for anyone in the state who chooses to be a peace officer. I think that, when we look at it across the board nationally, we actually have some very good training. Our training has to, again, continue to evolve. Our communities are not monolithic. Our training has to really be cutting edge, be national best practices. And we have to make sure, obviously, that we're funding that for all of our folks. But I think just continuing to have that more community-based training, I think, is always so very important. Training is really going to be paramount in terms of how we continue to progress and evolve.
Can I just add one thing? And it didn't work with the post board, but there was actually questions about whether in order to be a peace officer, you should be aged 21 versus 18. I think there's a big difference in brain development between 18 and 21. Even being able to see, frankly, a lot of traumatic experiences at that age, is that really the best way to go or not? So just want to add that to the mix.
Okay. Relocate for feedback reasons. Sue, we had one here for you. How do we support building a mental health system that is fair and just? And how do we move and how do we find money for it?
Well, you're already paying for it not working. I mean, seriously. But I think there's two things, and that is private insurance has to step up. I'm sorry, mental health parity is still a dream. It is not a reality. Right now in the state of Minnesota, most of our health plans will not pay for what's called a psychiatric residential treatment facility for children. We have children right now boarding in the ER for days, sometimes weeks, and we aren't paying for a psychiatric residential treatment facility, which is a step down from a hospital and a step up from our current residential. Why? Why aren't health plans paying for first psychotic episode programs when we know that that works? You know, why are the networks so narrow that every study shows that for mental health, you go out of network much, much more than for any other healthcare condition? So it isn't just state money going into it, and whether it's Medicaid rates going up, whether it is some grant programs when you can't bill for that particular thing through insurance, but our private plans have to step up and start paying for the care that people need.
Thank you. Here's one for Rhonda. You talked about the speed of trust. I've been in situations where there was a car accident and I've had young people yell at me for calling 911 because it would bring the police. What can we do to build back the trust of our younger population?
Yeah, that is another very good question. So I think we really have to make sure that we're having tough conversations. We have to be comfortable being uncomfortable. Again, we have to meet them where they're at. I've had conversations with young people. Matter of fact, I remember a conversation last year in North Minneapolis, and a young man said to me, and I remember, will continue to always remember this. He said, "Rondo, I'm tired of slow justice." And that stuck with me. And my natural and initial response to him was, I am too, but I've not seen in my lifetime fast justice. And that's I think you can hold both truths, but that's where they're at. And we have to have those conversations with them. And, you know, when situations occur, and whether it's in Minneapolis or across this country, that sparks an emotional or visceral reaction to whether it's something the police have done, it's usually going to be young people who are going to be out there showing their concern, showing their frustration, showing their anger. So again, I mentioned it earlier, we have to make an intentional effort to not only have young people at the table, but really genuinely and authentically help them guide those conversations as to what the future should be.
Okay, I think we've got a few here that can go to both of you. This is about the city contract with Canvas. It probably means Canopy, I'm wondering. And this is the crisis response teams. You know, how has that worked? And also, I think just the co-responder programs in general, maybe you guys could both address that. And as a corollary to that, how are 911 operators trained to be able to kind of broker who responds to what? And so, Sue, do you want to go first, and then maybe Rhonda, you can follow up?
Sure. I mean, Canopy works. There's no question about it. We have had mobile crisis teams in our state, so we know that they absolutely work. My only concern is that we make sure that we're also collaborating with COPE, the Hennepin County team, and that we figure out who does what. Because COPE does some things that are different than what Canopy does. They can do stabilization in the home for, 10 or more days, more for children. And people are kind of confused as to who does what. I've had people say, well, I live in Minneapolis. Can I call the COPE team? Because I've worked with them before. It's like, yes, you can call them. And we've also had people say, I don't want to call 911. I'm afraid to call 911. And so then kind of what we do. So, it's in its beginning stages. And again, we certainly support that, but we want to make sure that we also figure out how it works with the other systems that we already have in place.
Yeah, for those of you who may not know, the co-responder teams were teaming a plainclothes Minneapolis police officer up with a mental health professional. That Minneapolis police officer had additional training above and beyond crisis intervention training, was working literally in the car along with that mental health professional. When that program was up and going, it had great response. Matter of fact, I remember one of the compliments that we received as a department was that there were individuals who were utilizing COPE, which was really based on making sure that that individual could stay in their home and get these wraparound services. But they would actually call 911 and say, can you please send that COPE team? And so that's, I think that we'll continue. I think our city and other cities will continue to use that type of model, but I agree that they need to kind of know which is doing what in their lanes. And so, and as far as our 911 dispatchers, they have been additionally trained at trying to determine from the information they're receiving from the caller, which bucket or which response of service that should go to. So I think they're getting a lot better at that.
Are domestic violence calls still perceived as the most dangerous type of calls, and what kinds of responses are being considered? And an add-on is the social service community comfortable responding to those types of calls, or does it require law enforcement as well?
Yeah, so I do believe that domestic violence calls, when we talk about specifically assaults against police officers, those can be very problematic and be very significant of a risk to officers responding. Officers, it's very important for them to, to make sure that they're responding to the call, doing what they need to do, but also keeping in mind that those calls can vary. They can go up or down very, very quickly. One piece I do, and it touches upon some of the mental health training that we as a police departments have really taken into account over the years. There was a time when we as traditionally policing, the method was get there quick, resolve it. If you have to have one party leave and cool off, and that was it. And we chalk that up as a success. Of course, then we realized that there were, with that type of response, that we weren't serving victims. Victims were being assaulted and injured and worse at times. There were fatal injuries after that. But one of the things that we had learned, and I thought this was very significant when we talk about the intersection between public safety and public health, was when officers would typically go to a domestic violence call, they would certainly try to make sure the victim was safe and okay if they had to make an arrest. But what we failed to recognize were those children who were witnessing that. And one of the studies that came from that was when we would start to see 17 and 18-year-olds involved in violent crime, when we started to peel back and do a forensic look at when we first had contact with that child, they were 3 or 4 years old witnessing typically mom being assaulted. And we never thought about when we left that call, the trauma on those children. And so we're doing a better job of now making sure that we're trying to get those children as well in tune with services for trauma.
And I just said that is the point, because you're not going to have a mental health professional going out to resolve a domestic violence situation, but they need to be there to help the child and the victim.
Would the panelists address the impact of the prevalence of guns in the community on creating a just and fair public safety?
When I was serving in my role as chief, one of the things that kept me up at that 3 o'clock in the morning was getting a call that someone in our community had been shot and killed. And certainly guns are incredibly prevalent right now. There are way too many guns in our community. There are way too many of a mindset of solving and resolving issues with guns. And we have to make sure that we are doing our best to get those guns off the streets, but far too many guns. We are working closely with our federal partners and others to find out why those guns are getting into our communities at the rate and the number they are. But we have to address that gun violence, and we cannot become a city or a community that normalizes that type of violence. And so we have to do that. We lost several children last year to gun violence. It's unacceptable. It's appalling, and we should all be standing up and speaking out against that. So we have to continue to address gun violence. And I think we also, another truth, we have to hold those accountable that would harm our community and commit violent acts against us. So.
And I don't, so you talked about gun violence, but I'll talk about gun suicide, and suicide is not violence. And unfortunately, guns are a major means for someone to take their life. And so talking about means restriction education, the early warning signs in terms of suicide prevention are also really important as well.
Sue, would it be better if there were more group residence services, housing for persons with mental illness? And do you have an opinion on why Minneapolis, and I think you said maybe other communities around the state, are creating their own services rather than using some of the existing systems within the counties?
So when we talk about housing, Minnesota has gone down the road of creating, they're basically corporate foster care settings. So they're, 4-bedroom houses. And honestly, for a lot of people with serious mental illnesses, that is not a good option. You are living with 3 other people that you don't know or like. You are sensitive to sound, to smells, to, all sorts of things. It's hard to hire people for a 4-bed home who actually have a lot of training around mental health. Places that seem to have done better, especially people with the more serious mental illnesses who've been in and out of hospitals and the, correction system, are places like Touchstone's Rising Cedars. That's just over, kind of off Hiawatha there near Minnehaha. And people have their own apartment. They have like 30 some apartments. Maybe we should have less. They can cook their own meal if they want. They can come down and be with others. Many of them have told me that they are far more integrated into the community than when they were in a 4-bed corporate foster care setting. They're able to hire mental health professionals who can help them and guide them and really watch out for them and things like that, engage them in treatment. And that just seems honestly to be a better way to go, except the Department of Human Services has decided that that's institutional living. And so it's something that we're continuing to fight, but we want to make sure that, honestly, I've had far too many calls from family members where the medication wasn't given, or a young staffer didn't know how to deal with someone who is becoming manic and called the police when they didn't need to. So we really need to rethink how people live in our communities. In terms of departments doing this, I think it's because they want to do their own thing. And I think it's easier to do your own thing sometimes than to collaborate with someone else.
It seems that many problems peak due to resistance to authority. What is the appropriate response to resist to authority? And is authority responsible for taking action to make the community safer? Or maybe what is authorities or the police department's role in that?
Yeah, the resistance part, is that, repeat that, sorry?
Yeah, I think, it's that problems peak due to resisting authority. And I'm going to read into that. Like if someone's stopped by the police and there's some resistance to that authority, then there tends to be an escalation. And so, what is the acceptable response if you want to resist authority? How do you do that without it escalating? And what is the role of both the person who wants to resist authority plus the authority in that situation?
Yeah,
I hope I'm interpreting that properly.
Yeah, great question. So one, I'll touch on 2 parts to that. So one, and I've said this to whether it's a group of teenagers or adults, that if you are stopped by the police, common sense, what I try to stress to them, during that interaction, that is not the time to hold court. It's just not. You certainly are within your rights to ask questions or what have you. But in terms of trying to resolve that matter judiciously at the intersection, or I caution people from doing that. You can always, I tell, the now with technology, I tell community members, if you have an issue with an officer during a traffic stop or some other engagement, all of the squad cars have GPS systems. If you know the exact intersection, you don't even have to look at the badge number. If you know that it was squad whatever, or it was at 9:30 at night at this intersection, we can get that information of who the officer was. And then if you need to address that with the supervisor or file a formal complaint. But I just advise during the interaction itself, that's not the time to hold court. So I advise against that. The other thing that which we've all seen over the course of many years is this. And people, you have a First Amendment right to record your engagement or interaction with an officer. Now, you can't do anything to impede or obstruct what they're doing, but you have absolutely the right to record that. And so you're memorializing that engagement or interaction so that if you do have a complaint, that can be utilized. But I just, I would, there are just certain things that from common sense perspective, I just don't think it's the appropriate time at that moment to hold court, because if we're trying to focus on de-escalating a situation, that typically doesn't help in that regard. And so, yeah.
A question for Sue. There was recently something in the news about the surprising number of people in Minnesota with mental illness. Are there more people with mental illness now, or is it just more apparent?
Well, because of the pandemic, the prevalence rate has gone up quite a bit, about a 25% increase for anxiety and depression. But that's across the world, not just in Minnesota. The prevalence rates vary a little bit from state to state, but not wildly so. Actually, some of the southern states actually have a higher percentage of people with mental illness. So we're not like out of line compared to anyone else.
Okay, and it's no different than, say, except for the pandemic, than say 20 years ago.
It's risen a little bit in children, but I also think there's a great awareness that there wasn't before. I mean, I've been with NAMI 20 years and people talk about it a lot more now than they did 20 years ago. Even in the jails, I mean, there was a law that was passed in about, I think, 2007 that required everyone coming into the jail to get a screen. And so, about 2 years later, the sheriffs are going, we have all these people. I'm like, well, you screened them. That's how you know. So there's that awareness is just so much greater.
Okay. Rondo spoke about sitting in hospital waiting rooms, and he said, do you have the luxury of assigning officers to sit and do the same thing so they can have that same experience? Is there the time for officers to sit and have those same community experiences that you have?
I think it would be a wonderful experience. I'll just speak in my previous role as chief. The key word was time. I just, unfortunately, right now, I don't know if there's the time based on staffing needs to do that. Well,
and it actually gets to another question here about the appropriate number of officers. The CNA report documented have you seen the CNA report? No. The one that looked at the number of officers, but in terms of staffing right now, do we have the number of officers that we need in Minneapolis?
Currently, right now, absolutely not. And I mean, there's a lot of factors right now in there. I mean, right now we are third down. When I last left as chief of police, we were third down. We don't have the numbers that we currently adequately need.
Yeah, there's a number that kind of go together here, and this is sort of leads into that. I think is what would probably answer it. Is one of my family members is a police officer, and he entered into the force with expectations that are different from reality, and he wishes to choose a different career path. There's been very negative perceptions. What are incentives to enter or remain on the force? And I guess how do we increase the perception of the police force?
Yeah, a great question. Undoubtedly, the last couple of years have been just trying and challenging for the profession. Minneapolis, as well as other cities across the state and actually across the country, are struggling to get good men and women to be guardians and true public servants to their communities. So we have to do, I believe we have to do a couple of things. Right now, the state, and certainly looking at Minneapolis as well, everything from retention bonuses, being creative, looking at folks who are thinking about changing different careers or a different career path now. I think it's so important to lean on our communities, to reach out to young people, to really say, if you want to make a difference and step up, now's the time to do that. And we need you now more than ever. And so we have to do that. We also, all of us, and I go back to saying that we have to continue to improve this profession, but for at least the immediate future, we're going to need men and women who will rush into harm's way to protect our communities. So if we know that, let's start building up and making sure all of us can play a role in recruiting. All of us know individuals with good hearts, of good character, of goodwill, that could step up and be those people that we rely upon to trust, to hold that social contract near and dear to them. And I believe there's certainly more good in the world than there's bad, and those people are out there. We just all have to pitch in and really work on that. But it's going to be challenging, but I think that we'll all step up and meet that cause.
Another one for Rondo. During the Kroll police union leadership, the police seem to adopt a very strong warrior culture and an adversarial role or relationship against internal leadership. Do you think that this has changed, or do you see a change in the role of the Police Federation relative to leadership and management? Or would you agree that there was an adversarial role, I guess?
I'm trying to think back on history when there was such a loving role between unions and police leadership. And so dating pre-Tony Boza, I think he'd agree with me. No, unions, I think most police leaders understand that, unions have a core role and responsibility to look after their employees, their workplace environment, their wages, benefits, salaries, those types of workplace rules and conditions. That's always going to be here, and that's important. Sometimes that goes down to leadership personality sometimes, but I think most police leaders understand that you're going to have that relationship. I think there's a natural tension that's there always. That's not necessarily bad. The hope is that, though, at the end of the day, again, and I've said this before, the police contract is important, but the contract that supersedes that is that social contract. And our oath of office that every union member makes doesn't have any word there that says president, senator, congressman, council member, or union boss. It's the people. And so at the end of the day, all of us are charged to go out there and serve to the best of our abilities to our community. And so, if there's a union head in the country and a police chief that just, it's roses every day, I'd like to see where that exists. But
Okay, we got a couple more questions and we'll be wrapping up here pretty shortly. Another one for Rondo. How to resolve this conundrum? The police have dangerous jobs and with reasonable fear for their own safety, but qualified immunity means that police are shielded from accountability for how they respond. And is there a middle ground or some way around this problem for shielding police from, but yet they're in such a dangerous position?
Yeah, so that's a great question. And so I will push back where I don't believe that qualified immunity is this blanket tool that just protects officers from just doing bad things. That's I just don't believe that's the case, that officers put on that uniform and we're going to go out there and do bad things because we're protected by qualified. I've fired officers who had qualified immunity, and so that I think there's a misperception about that. I think that qualified immunity on its face is important. I mean, if we're talking, one of the things, unfortunately, in our society that I've just seen percolate so much over the last few years is we tend to deal in absolutes, which I totally want to caution us in doing in life. I believe that the vast majority of folks who put on that uniform are going out there to do good things in behalf of their communities. Just because officers have qualified immunity doesn't mean if they are involved in misconduct that they can't be held accountable. But I do believe that we have to, again, make sure that training's important, our policies, our relationships with our communities, and continuing to evolve and holding each other accountable. I think that's really what is front and center foremost. So, yeah.
Okay, we've got one question for both of you, and then we'll wrap it up and turn it over to Ellen. I think this gets to the whole purpose of why everyone is here today. How might citizens and communities be involved in the whole process of fair and safe public safety and communities, and also be involved in police conduct oversight and accountability in effective ways that actually support the whole building of trust. So both supporting the police and supporting the whole public safety, including our crisis response teams and alternative responses and things like that. So if you guys could each kind of give a response to that.
I'll just quickly say that public safety and community safety, it's an ecosystem. It's not just a one size fits all. So I would encourage our Rotary members and those folks out there listening, find out which lane you're comfortable in. If it's public safety, if it's policing, or you're part of a precinct block club, that might be your lane. If it's mental health, that's where you feel that you could lend your ideas and thoughts and feedback, then work on committees with that. If it's your school board, park board, I'd say that find your lane, because again, the world is run by those who show up, and it's going to take all of us in terms of that collective ecosystem to move things forward, but basically get involved.
Ditto. I would just also add that I think people need to get out of their comfort zone a little bit. One is everyone should learn, frankly, about how to deal with the mental health crisis. The chances of you running into someone at some point in your life who needs help is pretty high. And so just knowing basic de-escalation, knowing the suicide lifelines, although it'll be easier this summer because 988 will come into play. It's a much easier number to remember, which will certainly be helpful. And also, again, attacking the NIMBY issues and, talking to your legislators about this. We can't have, kind of safe communities without people being healthy and well. And so really pushing for health and wellness, both mental and physical, I think is also just really important.
And I'm going to break the moderator rule by responding from the League of Women Voters by saying, another really important thing that everybody can do is get involved and vote and understand the position of all of the people that are running for office and the issues that they're supporting, and vote for them. So that was a big rule breaker. Two last things. Somebody asked the question if the slides that I presented at the beginning will be available. And yes, I'll send them to Ellen, and she'll make sure to send them out to the people that registered, so they will be available. And the last one, I want to, from the audience, thank you for showing up. So thank you, Rondo and Sue, and the same to all of you out there. Thank you very much for showing up, and I'm going to turn it over to Ellen to wrap it up.
Wow, what a helpful sea of information and encouragement you've given us to consider steps we can all take. We may have forgotten to put evaluations on the table, possibly, but you will be getting one in follow-up, and we really appreciate your response to what you felt went well, what you would like to see different in future forums. I come away overwhelmed by what I've learned today. We want very much to have an opportunity to consider together how to proceed. And if you would be interested in being part of those discussions, you will have an opportunity on the evaluation form to leave your email so that as we think about next steps, the league has helped us or has offered to help us consider how to keep the conversation going in identifying next steps. I just want to thank you all for being here and for all your support in this wonderful panel presentation. Thank you so much.